webinar, and I'm also thankful for all the participants and the speakers. In the name of Allah, now I would like to invite Dr. Rida. Zainab, please share your knowledge about any topic. Please.
Assalamu alaikum. Today the topic of my presentation is Achalasia. Achalasia is basically the motility of the whole esophagus is decreased and the lower esophageal sphincter does not relax in response to swelling. It is a congenital disorder in which the number of ganglion cells in the esophagus are less than normal. Similar situation also occurs in Chagas disease, which is basically also called American trypanosomiasis, which is caused by trypanosoma. In that condition, ganglion cells in the walls of the gut, including esophagus, are damaged, and the clinical features resemble those of achalasia. Other motility disorder which can cause dysphagia is diffuse esophageal spasm. The patient with achalasia present with the following sign and symptom, which includes there is a long history of dysphagia to both solids and liquids. That may be intermittent initially, but later on it becomes persistent. The other symptom will be vomiting may be present. Vomitus is foul smelling and contains food eaten several days ago. And the patient may give history of recurrent pulmonary infections due to nocturnal cough, due to regurgitation and aspiration of esophageal contents. Clinical examination of the patient will be normal and the patient may be wasted. We perform the following investigation to confirm the diagnosis of achalasia. One of them is the chest X-ray, which will show the widened mediastinum due to dilated esophagus with air fluid level behind the cardiac shadow. Usual gas shadow in the fundus of the stomach is absent. The other investigation is barium swallow, which show the markedly dilated esophagus with a smooth pointed termination. The next one is endoscopy, which reveals the dilated esophagus with smooth mucosa. Lower esophageal sphincter, which normally opens as scope enters distal third of the esophagus, remains closed till scope is pressed against it and then suddenly opens, and scope easily slips into the stomach without much resistance. Endoscopy is necessary to exclude carcinoma of stomach. And the last one is the motility studies, which are manometry, which demonstrate the poor motility of the esophagus, high pressure of the lower esophageal sphincter, and lack of relaxation of lower esophageal sphincter in response to swelling. And it confirms the diagnosis. Thank you.